Extrapleural pneumonectomy risks and aspect outcomes. Surgical treatment for mesothelioma remains contested among mesothelioma medical doctors. Even as EP has been the usual approach for over 30 years to extend life for people with an early mesothelioma prognosis. It poses many dangers for even the most best candidate. 1/3 of the patients who receive an EP reveal in fundamental complications. EP complications can also consist of bleeding, blood clots, changes in coronary heart rhythm, chest fluid construct up, lack of lung function, pneumonia, wound infections, demise. Nonetheless, the University of California, San Francisco Thoracic Surgical Operation Branch says extrapleural pneumonectomy is probably the high-quality system to be had to control malignant mesothelioma. It delays the unfold of the disorder, improves respiration, and mixed with radiation and chemotherapy, it can lengthen existence expectancy.